What are the potential side effects of water fluoridation? Water fluoridation is a common public health measure aimed at reducing dental cavities. While it has benefits, it also raises questions about potential side effects. Let's break down what those might be. One of the most recognized side effects is dental fluorosis. This occurs when there is too much fluoride intake during the development of teeth. It can lead to changes in tooth enamel, which may appear as mild white streaks or more severe brown stains. While this condition is primarily cosmetic, it is the most widely accepted adverse effect linked to fluoridation at recommended levels. However, there are concerns about other potential health effects, especially when fluoride intake exceeds safe limits. Some studies suggest that high fluoride exposure could be associated with neurotoxic effects. This means that children who are exposed to elevated fluoride levels in drinking water may experience lower IQ scores. Most of these findings relate to fluoride concentrations higher than what is typically used in community water fluoridation programs. Another area of concern is skeletal effects. Fluoride can accumulate in bones, and excessive intake over long periods may lead to skeletal fluorosis. This condition can cause joint stiffness and bone pain. Some clinical trials have even indicated that fluoride treatment for osteoporosis might increase the risk of fractures, suggesting that too much fluoride could weaken bones. Fluoride exposure has also been linked to changes in thyroid hormone levels. This could potentially affect metabolism and growth, particularly in vulnerable populations that may already have iodine deficiency or other nutritional issues. Additionally, there are some studies that indicate fluoride might have nephrotoxic effects, which means it could impact kidney health. There is also some research suggesting that fluoride may affect reproductive health, although these findings are less consistent and often relate to higher exposures than what is typical in fluoridated water. It is also important to consider potential contamination risks. During the fluoridation process, there is a chance of introducing contaminants like arsenic if the fluoride chemicals used are not carefully monitored. From an anthropological perspective, these side effects raise important questions about social equity and consent. Community water fluoridation delivers fluoride to entire populations, regardless of individual health status or water consumption habits. This means that vulnerable groups, such as manual laborers, the elderly, and those with kidney disease, may be at higher risk of adverse effects. While fluoridation can help reduce dental health inequalities by providing fluoride access to those who may not have regular dental care, it may also disproportionately expose marginalized populations to potential harms. In summary, the primary confirmed side effect of water fluoridation at recommended levels is dental fluorosis. Other potential adverse effects, mostly linked to higher fluoride exposures, include neurotoxic, skeletal, thyroid, kidney, and reproductive concerns. These risks highlight the need for careful monitoring and consideration of social factors in fluoridation programs.